Hi, my name is Dr. Maria Buencamino-Francisco. I'm currently practicing as a primary care physician at the Brigham Health Harbor Medical Associates in Hingham, Massachusetts. I am board certified in internal medicine, and my special interest is women's health, particularly midlife women's health, such as perimenopause and menopause and osteoporosis. I am a certified clinical densitometrist, a North American Menopause or NAMS certified menopause practitioner. I was born and raised in the Philippines and graduated from med school at the University of Santo Tomas. I then pursued my dream of practicing medicine here in the United States to be close to family. I am also very much involved in charity work. I am currently the president of the Philippine Medical Association of New England. I'm happily married with two wonderful children. I have a 12-year-old daughter and a 7-year-old son. I love dancing, cardio kickboxing, and traveling.
Thank you, Doctor. Now, with your focus on women's health, my first pressing question is, what's a densitometrist? I even mangled that. What's a densitometrist?
So a densitometrist is somebody who reads bone densities. So bone density is a screening test for osteoporosis. So we start doing bone density screenings in women 65 and older, or in those who are in their postmenopausal years with risk factors. So, such as history of fragility fracture, what we call a fracture obtained or that occurs from a fall from a standing height, or if somebody has a family history of hip fracture in their parents, low vitamin D, and other risk factors.
And this is, again, focused around the age group profile for just women, or are men also perhaps included in this group?
Yes, so but osteoporosis is not just a disease of women, it also affects men. So we usually recommend bone densities in men at or after the age of 70, or younger if they have risk factors like, for example, low testosterone or overactive parathyroid gland called hyperparathyroidism, and other medical conditions that can increase risk for bone loss.
And with that bone loss comes the higher risk for fractures, for example, and perhaps where with that, is it where the bone dies, for example? What's the term that's used when that happens?
Yeah, so osteoporosis is basically what we call as a condition where the bone gets thinner and weaker, and that causes an increased risk for fractures. So in postmenopausal women, specifically in the first 5 to 7 years of menopause, this is the period where women lose bone most rapidly, and they can lose bone by up to 20% during this time. And so we are at this period, I always counsel my patients to make sure they take adequate amounts of calcium, vitamin D, weight-bearing exercise to prevent further bone loss and lower their risk for fractures.
When we talk about calcium, as in calcium supplements and the like, what do you have recommendations about where and how one goes about making sure they have the right level of calcium in their systems?
Yes. So I recommend that my patients take about 1,000 to 1,200 milligrams of calcium per day, preferably through their diet. So when I see a patient, I usually give them this table of calcium-rich foods. It gives them the amount of calcium per serving, and I tell them, focus on your calcium, dietary sources of calcium, and you only need to supplement whatever's missing from your diet. So for example, the average American diet has about 600 milligrams of calcium. Then you only need to supplement another 600 milligrams through over-the-counter supplements. And I give them a table of the different calcium supplements that they can get over the counter, and also vitamin D. So there's really not a lot of foods that are rich in vitamin D. So I typically recommend my patients to take vitamin D supplements over the counter, about 1,000 units every day.
What are you seeing among our patients today? I mean, as an age demographic, we're relatively active. We're more active than our parents were. So with that in mind, are we presenting with more injuries? And what are some of the challenges that you face in treating these needs?
So actually, so there's more and more people that are being diagnosed with osteoporosis, right? It's probably because we're also doing more screenings nowadays with advancement in our technology, right? So the challenge that I face in treating women, even men, who are diagnosed with osteoporosis is their fear of the side effects of the medications, right? So when I talk to them about treatment, I tell them, there's risk in treating, there's side effects of these medications, but there's also risk in not treating the osteoporosis, which is increased risk for fractures. So we just have to balance the pros and cons of these medications. In somebody who's really high risk for fractures, high risk for falls, I definitely encourage them to take medications such as, we call it the pharmacologic treatment to prevent them from losing more bone, prevent them from fracturing and getting the consequences of fractures. Let's say, for example, somebody fractures a hip. Studies have shown that there's increased risk for mortality after a year after fracturing a hip. So I explain these things to my patients, and I don't force them to take medications, but we do a shared medical decision, and I respect whatever decision they make. And I'm here to guide them as their doctor, explain to them the pros and cons, and in the end, we make a shared decision.
If a person picks up a box, turns the wrong way, could they actually injure themselves? And would that be a precursor to get themselves checked out for bone density, for example?
Exactly, yes. So that kind of fracture is what we call a fragility fracture. So it's a fracture sustained from a minor trauma or somebody who falls from a standing height. We get concerned about decreased bone strength and decreased bone density, and that could be a trigger for getting a bone density. So once a patient gets a bone density done, and the bone density does not show osteoporosis, but only shows osteopenia, which is just thinning of the bones, but not yet to the osteoporosis range. If the patient has osteopenia but sustained a fragility fracture, we still consider that as clinical osteoporosis, and that would also warrant treatment.
That's important information to know. You're at Brigham's Health, and you have a Hingham facility. What other facilities do you have here on the South Shore where we can avail ourselves of your services?
Yes. So besides the Hingham location, the Brigham Health has also locations in Weymouth, Scituate, and Pembroke. So our office in Hingham offers lab services and primary care services. And the other offices also offer lab and radiology services. We also have a vast specialty in the other locations. So we have cardiology, pulmonary, sleep medicine, OBGYN, surgery, urgent care, and many other specialists.
So what you've described is a pretty robust offering of services that we don't have to travel all the way into Boston to avail ourselves of. It's right here on the South Shore. That's pretty good.
Exactly.
What else would you like to tell us about your services and what's available to us here on the South Shore?
So as I mentioned, so we have a lot of primary care doctors in the South Shore. We have family medicine services as well. So we see some of us see pediatric patients. I myself focus only on adults, but we do have doctors who do family medicine in the Pembroke office and the Weymouth office. And imaging is also available in our South Shore location. So people really don't have to travel to Boston to get all of these services.
And in this COVID, and we know that on occasion, some of us are fearful of going to the hospital, particularly for elective procedures. What can you say that assures us that you're ready to handle us in a very safe, socially distant way?
Very good question, Joe. Thank you for that. So in our Hingham location, we screen our patients closely before they come in for the office visit. We actually screen them at the time that they make the appointment, the day before the appointment, and as soon as they come into the office. So we do the COVID screening test. If somebody shows any signs or symptoms of COVID, we either ask them to reschedule their appointment, or we can offer virtual visits, or if they don't have video capability, we can do telephone visits. And if they really need to be seen, we have them go to our fast track office in Pembroke to be evaluated and managed in that location. So we do have a lot of options.
Indeed, you do. Some other things that we would like to cover. We talk about heart disease in men and women. I mean, in terms of your general medicine practice, what else are you seeing in the adult age, category?
So heart disease is very important. Actually, heart disease is not just a disease of men. In fact, heart disease is still the #1 cause of death in both men and women in the United States. And women are more likely to die following a heart attack. And they also tend to experience delays in emergency care. And this could be because of a typical presentation. So while we all know that men can experience the typical chest pain radiating to the shoulder or to the jaw, women may present with subtle symptoms like feeling nauseous or feeling of a sense of indigestion, back pain, or just overwhelming sense of fatigue and lightheadedness. And these could be symptoms of a heart attack in women. So that's why we're trying to educate our women with all these campaigns to increase awareness of heart disease in women.
Let's talk about some other areas dealing with adult health. Let's start with mental health and stress. And is it different between men and women, especially in this COVID?
Exactly. So there's actually more women who are being diagnosed with anxiety and depression, and stress is on the rise in women, especially nowadays. During the COVID pandemic, a lot of women are faced with challenges at work, challenges at home. While we're working at home, we may be taking care of our kids who are also homeschooling. So that adds an additional stress to us. And also a lot of women are, taking care of their elderly parents who may be sick, right? And they're also trying to manage a household. So there's really a lot of things going on, a lot of challenges that women are facing. And this increases the risk for anxiety, depression, even other physical manifestations like migraine headaches, right? Chronic fatigue, fibromyalgia, and may also increase risk for alcohol and drug abuse. So as a primary care physician, I always emphasize to my patient, I try to empower them, to take charge of their health, right? A lot of times women focus on taking care of their families and forget about themselves. So I encourage them to take care of yourself first, because if you're not healthy, it's impossible for you to take care of your family.
That makes an awful lot of sense. What are some of the other key factors that are influencing women's health? Can you think of?
Yes, so I think there's several factors that influence women's health. So we have hormonal factors, social cultural factors, access to healthcare. So we touched a little bit on the social cultural factors, and this relates to the women being faced with more and more responsibilities and not being able to take care of themselves. This goes hand in hand with access to healthcare. If they are overwhelmed, they're tired, they're taking care of everybody in their family, they often delay seeking medical care. So the other factor is hormonal changes. So throughout a woman's life, or most of our life, we experience hormonal fluctuations, right? So with these hormonal fluctuations, we may experience premenstrual symptoms, premenstrual migraines, mood swings. And as a woman goes into midlife, into perimenopause and menopause, they may experience hot flashes, night sweats, changes in sexual function, sleep problems that can affect their mood, can affect their energy, the weight, a lot of women complain about weight gain in menopause. And there could be a decline in bone density and increased risk for heart disease.
We've covered a lot of information here, and it's just so enlightening. And where can one find out more information about your services, your practice? Do you have a website or anything that we can go to?
Yeah, so we do have the Brigham and Women's Health website, and you can access the services and locations, hours of services, even imaging and specialty services that we offer in our locations.
Dr. Maria Buencamino-Francisco, thank you so much for your time today.
Thank you, Joe, for having me.